Good afternoon, everyone. My name is Yasmina Sisrak, and I'm your host for today's webinar. Thank you for joining us for our 6th COVID-19 webinar in our webinar series presented by the HealthMatters program in the Department of Disability and Human Development at the University of Illinois at Chicago through continued partnership with Project Search and their funding from the Ohio Developmental Disabilities Council in collaboration with Aspire Community Services in Illinois. So for today's presentation, Survival Coalition and the ARC Wisconsin, determining what's needed now and in the future in response to COVID-19, we are delighted to have Lisa Pugh joining us. Lisa Pugh is an executive director of the ARC of Wisconsin, has worked for the disability community for years, and has been leading the ARC Wisconsin since December 2016. Previously, Lisa has served as Public Policy Director for Disability Rights Wisconsin. She was appointed by President Obama to the President's Committee for People with Intellectual Disabilities. Lisa is also the co-chair of Governor Tony Evers, I hope I'm pronouncing that name right, Task Force on Caregiving, which is addressing issues impacting more than 500,000 family caregivers in Wisconsin. And she's the parent of an adult daughter with intellectual and developmental disabilities. A little bit about today's presentation. Wisconsin Survival Coalition of Wisconsin Disability Organizations has been an active alliance in analyzing statewide COVID-19 policies that impact people with disabilities and advocating for change and improvement where necessary at the state level, from first highlighting the risks to people with disabilities through an amicus brief to the state Supreme Court, to later guiding state and local reopening policies. The coalition and its members are attempting to stay ahead of critical COVID-19 issues that are impacting people with disabilities, families, and the providers who serve them. Lisa, welcome. Again, I just wanted to mention that we are recording these webinars and we're making them available in about a week after they're done. We are captioning the webinars as well. You will be emailed once the webinars has been archived. During the webinar, please note your questions in the chat box, and we will ask these questions during the last 15 minutes of the webinars. Thank you again for joining us, and Lisa, welcome.
Thank you, Yasmina. Thanks for that introduction, and welcome to everybody on the webinar today. It's really great to be with you this afternoon. As we get started, just a reminder about what we were planning to talk about today from my experience with the ARC Wisconsin as co-chair of the State Survival Coalition. We'll be reviewing that impact of COVID-19 pandemic on state level policies. We'll kind of work together and identify some of the current issues that apply across states for people with intellectual and developmental disabilities. And then I hope to share with you some best practices for organizational viability during the COVID-19 pandemic. So just as far as introductions go, just to kind of let you know where I'm coming from. So who's the ARC Wisconsin? You might be familiar with the ARC. The ARC is a national organization that's been around since the 1950s, advocating for and alongside people with intellectual developmental disabilities and their families. Most states have a chapter of the ARC, like Wisconsin. There's about 600 chapters across the country. And in Wisconsin, I direct the state office, and there are 14 local chapters in our state. And then the Survival Coalition, you may or may not have a coalition like this in your state, but the Survival Coalition has more than 30 members, approximately 40 state and local organizations that are very advocacy oriented. And so for more than 20 years, really, we've been working as a cross-disability advocacy organization to help people with all types of disabilities to be full participants in community life. So we have issue teams that work across issues like employment, like transportation, children's issues, Medicaid, adult long-term care, special education, and get meetings within our governor's office with state agencies and other leaders to try to advance this goal. So as I go into kind of this next slide, I really like, if you are at your computer, to just type into the chat what state you're from, to get a sense of who's on the call, kind of where you're from. Much of what I'll be sharing today is a state perspective. And so what I'm hoping is that as I talk, you can think about how you can maybe access some of the information that we have been using in our state and addressing issues in a similar way. So I'm seeing Missouri, Florida, Illinois, we're all over the country. Okay, so maybe you're already doing some of these things, or maybe you're going to take away some ideas today. But I think we all might be aware of some of these things, but what certainly we're learning, people with intellectual developmental disabilities, high-risk population, and that's because generally of underlying conditions. So we know that people with disabilities overall 3 times more likely to have heart disease, stroke, diabetes, but then for people with IDD, they're often in these, what we're very much learning in the pandemic, are high-risk settings, congregate settings. We're learning that some of the key issues are related to how home and community-based services can continue to provide safe and quality supports to people during a pandemic. We're learning a lot about, as we've been living through the direct care workforce crisis, how can we elevate the status of direct support professionals in our home and community-based services system so that they can get the things that they need to continue to do their important work. We've all learned that term, medical rationing, and unfortunately have had to advocate for people with intellectual developmental disabilities during the pandemic with state-level policies. Family support issues, all of those family support issues that were there pre-pandemic, we'll talk about a little bit, but they've certainly been highlighted during the pandemic. And then I think going forward, we really are thinking about what is that new normal and how does that look for people with intellectual and developmental disabilities. So I'm looking at my states here, North Carolina, Ohio, Wisconsin, Illinois, Florida, Missouri. Okay, great national representation. Thanks for joining today. So Yasmina mentioned that the ARC Wisconsin was a partner on an amicus brief. Actually, the ARC of the United States kind of led the drafting, and in our state, like I'm sure is in all of yours, there was a scattered plan for reopening. Ours just happened to elevate its way to the Supreme Court, where there was a challenge as to when the reopening should happen. But this provided an opportunity for us to highlight how people with intellectual and developmental disabilities are a high-risk population. And if you think that that's information that would be valuable for you, and I mention it because not that our amicus brief was so successful in the Supreme Court, because ultimately the Supreme Court ruled to continue with an earlier reopening than what we had advocated for. But I would say the win here is that we were able to create a lot of awareness around people with intellectual developmental disabilities as a high-risk population. They really weren't on the radar before that. And so if you search for the ARC Wisconsin or the ARC United States Wisconsin amicus brief, you'll find a pretty nice narrative with some national data and background information about people with IDD that might be helpful to you. And so just a few things that we outlined in that brief are, basically the health-related reasons that put people with disabilities generally at greater risk for serious complications and death. We know that they are more likely than other adults to live in congregate settings, such as group homes or nursing homes, and also that people with disabilities, they can't social distance. They often require assistance from a workforce that just can't do that. They're getting help with their meals, with bathing, with dressing, things where 6 feet apart just isn't possible. And so we tried to lay out the case, and I think a lot of that work that we did in the amicus brief in creating awareness continues to be helpful to us as we advocate around other public policy areas since our state's reopening. This is data that I would say, if you aren't aware of where it is in your state, you should find out. And if your state isn't sharing this information, they should. I don't even think this is all the data that we need. And I'll talk later about the sorts of data that I think we need to advocate for next. But at least we have some sense here of what's happening to people in congregate settings. So the estimates from the Kaiser Family Foundation in Wisconsin, about 1.5 million people considered at high risk of serious illness if they were to be infected by COVID-19. And this includes 19% of all adults under age 65. So these aren't older adults, these are also people under age 65. And that risk level that is assessed for people is really only about those underlying conditions. Nobody's really assessing risk related to people living in congregate settings. But you can see here this is just a snapshot of Wisconsin's deaths, percent of COVID-19 deaths by group housing. 44% of all the deaths in Wisconsin happening in a long-term care facility. So in Wisconsin, that would be a term that they would be using for a nursing home or other community-based residential facility. Other group housing, unfortunately, our state is kind of lumping that into a very general category that can include everything from corrections to other sorts of adult family homes and other sorts of group settings. So I don't find that to be particularly helpful, but I think the takeaway here is that congregate settings are seeing a significant proportion of the deaths. And then I think the other piece that we've all become more aware of is this equity issue as it relates to the pandemic. In Wisconsin, African Americans are 6% of the population, but 39% of all of the deaths. And so that's definitely something that we need to be addressing going forward. I mentioned the family support issues, and I think this is something that's really important for people to pay attention to. So this was an issue in the IDD community prior to the pandemic, was with a lot of people with IDD living with their families. So in Wisconsin, we see that approximately, I think it's anywhere between 60% of people with IDD living with family. And then you see here that about a quarter of those people living with family are living with parents who are doing caregiving that are over age 60. And so this was something that across the country we had already been paying attention to. And I don't know about you, but I'm certainly seeing in our state where a lot of these older caregivers are struggling now to continue to provide care for a loved one, not just kind of overnight, but all day, as people aren't going to the same services and programs that they may be used to. So this dealing with these family support issues, I think, is going to continue to be a problem. I'm just checking the chat here. I see that somebody was able to post to our Amicus brief and some of that other information. I'm seeing somebody saying that they're not able to hear, but I don't think that's a problem for most people because they were able to respond to the chat. So I think that this family support issue is really highlighting what is going to continue to be a crisis. And if you caught this article from the New York Times from last month, it was a very heart-wrenching article about a mom who had been living with her adult son who had autism, and she got coronavirus and died, and her son with autism was left alone. And I think that supporting family caregivers, getting them connected and helping them to make crisis plans like this if something happens to mom or dad is really important. And so a lot of the work that I do with the ARC Wisconsin and that the ARC US does is in the area of future planning. And so a lot of the survey data that we have shows that anywhere between 50 and 80% of all family members with persons with IDD do not have any sort of future plan in place. Like they might have a will or something very basic related to finances, but in this case, it was really about where was this young man with autism going to live if something happened to mom or dad. And that's the type of future planning that we think there needs to be more of, particularly as we continue with the situation of aging caregivers of adult persons with IDD. So I mentioned the Survival Coalition as having kind of this goal and mission to increase, community integration and participation for people with disabilities. And as the COVID pandemic came about in our state, we needed to divert and kind of put out fires as they came. And so I'll walk through some of those crisis issues that we summarized at the beginning to let you know kind of how we address them. The first thing we wanted to know in the early weeks of the pandemic, and I think we will do another of these surveys now that we're several months in, was ask people with disabilities and their families how they were doing. So we got more than 500 responses, and in Wisconsin we hit about 78% of our counties, so we felt like that was a pretty good response. It was just a traditional SurveyMonkey survey, and we asked people what had changed in their lives. And a big finding, not very surprising, was that 37% of people reported that families were providing some or all of their daily personal care and support instead of their normal paid staff. The young woman that you see on the screen there participated in our press event where we shared with the media via a Zoom press conference the results of that survey, and she had been living independently in her apartment. She ran her own business and also was employed at a local company, and had to move back home with mom and dad and lost both of her jobs. And still, I believe that's the case for her. I think she might be doing some remote work, but she's a graphic designer, and all of her setup for her business was in her apartment and could not be transferred back to her parents' home. So I think that what we were trying to do with the press event and the survey both, as I mentioned earlier, was we saw a big role of ours was just simply creating awareness, getting people with intellectual and developmental disabilities inserted into the conversation, kind of on the top of the priority list of people to be concerned about. Somebody's asking for putting the links to the PDF in the chat. I think we can definitely do that.
I will do that. Thanks.
Perfect. So I think that, so as you're listening to me talk today, if this is not something that you have done, I highly recommend a survey and turning that into a few awareness and or policy pieces. We definitely used what we learned in this survey to make, not only to talk to the media, and we had a lot of media that simply took clips from our Zoom press conference and then turned that into a 5 o'clock news story, but we also turned these into policy papers for our policymakers. Another thing that the survey helped us to do was to document stories. And here's just one example, very compelling stories, heart-wrenching stories, even in the early weeks of the pandemic from people. Here you see a quote, "My wife and I started experiencing symptoms consistent with COVID-19, but we have not gotten tested or unsure if we'll be able to be tested anytime soon. My brother requires round-the-clock care and supervision, making it hard for us to care for him with our symptoms." So back to that family support issues, families doing 24/7 care and support, and still doing that for many people, especially elderly parents who maybe don't want their adult sons and daughters to be going back to their normal activities because they're concerned for their own health. So I think these stories really helped us to highlight those concerns, and we have had some public policy success because we did this work. I mentioned the term medical rationing, and I'm sure this is something that you're tracking in your states, where you may likely have, like we did in Wisconsin, a medical panel. In fact, ours was convened early into the pandemic. Some states already had medical advisory committees at their state level, might even had state policies. Well, this was an area where Wisconsin was behind, and you really don't want this sort of policy to be made in haste, which is kind of the direction it was going. And they didn't have any individuals on this panel or this advisory committee that had any IDD experience at all. And so we successfully advocated to get the director of our UCED, our University Center for Excellence in Developmental Disabilities, to be appointed to this committee, as well as a registered nurse that's worked for decades with individuals with intellectual developmental disabilities, because a lot of the policies that they were talking about were going to definitely be impacting people with IDD. So this is where they were discussing who would get a ventilator, and what is the, what's the priority order in which people would be treated if there was any need for rationing. And we saw this as the blueprint even for later down the line, who may or may not be first in line to get a vaccine, and also kind of building into this conversation about things like access to PPE. Who are the very vulnerable and important people to be supporting? In our survey, we had nearly half of people already expressing very early on that they were worried if they got hospitalized with the virus, that they wouldn't be able to meet hospital triage criteria. So you'll see, thank you for putting these links into the chat. This is an example of one of our earliest communications with that committee, and we communicated with them often and continue to communicate with them about their rationing policies. But there's some great national work being done by both the ARC-US and the Center for Public Representation with great sample materials if this is something that you're looking for your state. But I highly recommend knowing if your state has put out a policy, because the way this is played out in Wisconsin is that the state has put out some guidance, but has not issued a statewide policy, and that was in part due to pressure from our Wisconsin Hospitals Association, which basically means that you could go to any of our hundreds of rural hospitals in Wisconsin and be treated under a different sort of ventilator policy. And so that's what we were hoping to avoid. We think that the guidance should be helpful to some of those smaller hospitals, but they're still really very much of a spotty approach on this issue. And we hope, because we've been able to contain the virus somewhat in Wisconsin, we're not one of those spiking states, the issue of rationing ventilators has not been an urgent issue yet. I will just say that. The next area in which we were advocating, which I mentioned earlier, was just paying attention what's happening broadly to home and community-based services providers. And we were hearing early on from providers, as you can imagine, people staying home, providers not billing for services, and particularly for some of these smaller providers, we became very concerned about their viability into the future. So in Wisconsin, we think that a strength of our long-term services and support system is the great provider network, small providers, large providers, supported employment providers, community-based day providers, pre-vote providers, a great variety. And we have, of course, like all states, a mix of rural and urban areas, and people have choices. And we were seeing, when we issued our first survey to providers, that a fifth of these providers told us that they might actually be forced to close because of COVID-19 impacts. And that was in part because, as I mentioned, decreased revenues, but also in terms of increased costs. So people are telling us not just having to purchase their own personal protective equipment, because as you know, in the home and community-based services network, we weren't necessarily first in the queue to get things like PPE, and in many cases, that's still the case. People having to purchase additional cleaning supplies because of reduced staff. They had overtime pay, additional staff training costs, food costs, you name it. That's what providers were telling us they were now having to budget for. At the same time, 43% telling us that they had decreased revenues. So I think it might actually be higher than that said that they had decreased revenues, but it was enough of an amount that we communicated to our Department of Health Services about this concern. And then also people telling us how they were trying to adapt and make changes to their service delivery to provide virtual services, but they weren't yet getting paid. So the payers, in our case, the managed care organizations, were not necessarily meeting the need of the of the service providers who were already trying to adapt to continue service provision virtually. And I think that's gotten better, but it's still the case in some areas of the state. So the state survival coalition also provided a lot of guidance, as I mentioned, after that amicus brief and the Supreme Court said that the state should reopen. A lot of communities really rushed to reopen, although our home and community-based services providers, for the most part, held back on reopening. We realized that our role really was in providing recommendations and considerations for procedures on how home and community-based providers should reopen. And a lot of our focus, and that might be different in your state, is because the state was not really holding the reins anymore in terms of reopening. It was our local public health departments. And our providers were telling us that a lot of public health didn't even know they existed. So didn't know where maybe the group homes were, didn't know what day services were, who went there, how many people in the county. And so we really encouraged in our recommendations, and survival is generally communicating at the state level. But in this case, we also sent our recommendations to local public health directors to say, you really need to know where your home and community-based services providers are in your community and what their needs are. And our hopes really were that as things like PPE and tests were sent out to local public health departments for disbursement, that at least in their mapping, that home and community-based services providers would be on the list. I think what we saw, and probably what you saw in your states, is that nursing homes were definitely, they knew where the nursing homes were, nursing homes priority, but some of these other settings where there were some of the same concerns about people needing direct cares from professionals, that they really weren't part of the planning process. So I think that we did our best to provide guidance here on reopening that included everything from, preventing infections, ensuring continuity of care for people, but also talking about preserving people's rights. What we saw a lot early on was providers just putting policies in place that were really restrictive to people, and they were receiving no real guidance on what they should and shouldn't be doing. But people's rights don't go away just because of a pandemic. And so we tried to use our communications to clarify that. We also talked about responding to outbreaks. And another really important area, I think, was in the area of communication, just reminding the state, local public health, and providers that individuals and families really needed some regular, transparent communication about changes in policies, changing protocols, and making sure that that information was shared in an accessible way. So that's what you'll find in that document from the Survival Coalition. Regarding reopening, I'll just say, I'm not a provider, but looking at those things that maybe weren't addressed in other pieces of guidance, I think is where survival felt like our expertise was. So on this slide, you see that for most providers who wanted to reopen, they relied pretty heavily on the guidance coming out from the CDC, coming out from our state, and that concluded the logical things that you would imagine would be in somebody's plan. What are the new hygiene and cleaning protocols? What are different staffing patterns and groupings, smaller groupings? What are we going to do about testing and use of PPE and plans if people test positive or when they get sick? I think that's kind of the 101 of pandemic that a lot of people started with and where most of the written materials exist. Now, what we've tried to do as Survival is to talk about what are maybe some of those other things that are really important that might be neglected. So you see some of the things I've already talked about in terms of participant rights and communication plans, but also, person-centered planning. We know that the pandemic has had an isolation effect on a lot of people with and without disabilities. And we totally anticipate for people with intellectual and developmental disabilities that kind of going back to some service support or routine they had before might be difficult, and there might be new challenges. And so important to sit down with that person-centered planning process and think about, you know, what do we maybe need now that we didn't need before? I'll just say, speaking from my own perspective as a parent, my daughter is 20. Oh, she just turned 21. Good reminder to me. And she has an intellectual developmental disability, and she doesn't use her voice to speak. And she has some, you know, challenging behaviors due to her regulatory system. It's hard to regulate herself. And so pre-pandemic, she had a job Monday through Friday, 9 to 11, and after that, a community-based day services provider would take her someplace to eat her lunch, and then she would go and she did some volunteering 2 days a week, and then she did other sorts of fun community-based day activities, listening to music, going to the Humane Society, different things that were important to her, and she had staff to support her. Well, after the pandemic, the restaurant she was working at, they closed down. The day services provider said, we can't come and support your daughter anymore. And all of a sudden, she's home with mom and dad all day. And so it's been very challenging for her. And I think we've definitely seen that in terms of her behaviors around home. And I know it will be hard for her to get back into any sort of routine. So I really hope that person-centered planning can think about, are there some behavioral supports or communication supports or different sorts of visual schedules that she may need put into place now that she didn't necessarily need before. And I think that person-centered planning is going to be key for a lot of people, and it will need to be revisited for folks. And then also a thing that I think we've been talking about in the Survival Coalition is there will be people with intellectual developmental disabilities who cannot comply with the new protocols. I see the reopening plans for schools and all of the things that are expected of kindergartners, and I'm thinking anybody who's ever had a 5-year-old without a disability, I can't imagine that, how that's going to go. But I think for people with intellectual developmental disabilities who have sensory and other issues, simply getting them to wear a mask is going to be a really hard thing. So how do we not leave those people behind, especially if they are people who are living with those aging caregivers that we have been talking about? So I think that providers really need to start thinking creatively about how those can be parts of their reopening plans as well. So what are the things that we see as next? I definitely see that there's a need for better data. Like you saw before, the data that our state is collecting doesn't really give us that granular data about what is happening in congregate settings where people with intellectual developmental disabilities are. And then how do families and public health at the local level really know where outbreaks might be happening, and how can they respond to them before they get to a crisis level? I think we also need better data related to equity and race to know exactly where things are happening and how we can address those. Coordination with public health, I think there need to be stronger partnerships between home and community-based services providers, and that needs to be facilitated through policy. With local public health. I just happened to have a really great chapter of the ARC in Fond du Lac, Wisconsin that was very assertive and reached out to their local public health department and said, we want to be one of the first home and community-based services providers that's doing rapid and routine testing of both our staff and clients. And they are a model for that level of testing, which I know brings a lot of assurance to the families who send their loved ones with disabilities to their settings, whether it be the day services that they offer or their residential settings. And then one thing that I feel is really important is our continued support for the home and community-based services provider network. We are really concerned in Wisconsin about the shrinking of that network over time if there aren't policies and funding in place to support the network. So you've probably seen at the federal level that we're hoping that Congress passes another package of supports that can include some very targeted funding for the home and community-based services provider network. But currently there, other than the PPP loans, there was no, and which many HCBS providers did utilize, there's been nothing really that's been holding up the provider network specifically. In Wisconsin, I forgot to mention that as a result of our provider survey and kind of the awareness that we were able to shine on the needs in the provider network, our governor did direct $100 million of the CARES Act funding that came to Wisconsin. So there was like a pretty flexible pot of CARES Act funding that needed to be spent on COVID-related concerns. And so our governor, due in part to our advocacy, did dedicate $100 million of that to the needs of emergency responders, long-term care facilities, so including nursing homes, and then specifically the home and community-based services provider network. Now that money isn't getting out quite as flexibly as we'd hoped. Providers are reporting some difficulty with accessing that funding, and we think in order to support the network, it really needs to get to those providers quickly to then in turn get to those workers. So we're monitoring that. We've done another survey. We continue to communicate with the department, but it's something that I urge all states to really pay close attention to because I don't think we want to come out on the other side with fewer providers or a lower quality home and community-based services provider network, which leads me to my Pollyanna view of the world. I think that as a positive thinker, I think there are some silver linings that we can take forward in reimagining service delivery for people with intellectual and developmental disabilities. And I'll just mention a few things that I've been thinking about. I think that there's definitely a greater awareness of safety in smaller home and community-based settings. So if you're someone like me who really thinks that we could do a better job of moving to more independent community-based settings for people that are less restrictive, less institution-like, we certainly have the argument here that the pandemic has shed light that congregate settings don't necessarily facilitate independence and good quality of life for people, but they also are not necessarily safe in situations like this. So how can we use this data to help us build on that narrative and create even safer, higher quality community-based settings for people to live and work and participate? I do think that we've also learned a lot about virtual service delivery, and it really gets me excited to think about all the people in rural Wisconsin who now can actually take a class or sit on Zoom with their peers and be thinking about and talking about things that interest them that can really be person-centered. So they're not just being plugged into the program that's down the street, or maybe there's no program at all because they live very remotely. And I think what I hope happens here is that you won't just be able to take the class that happens to be provided by the provider that's in your plan, but that you might have a greater array of virtual classes or services that are available across the state. So I think there's definitely potential there to reimagine what service looks like on the other side of the pandemic. I also think people are have more awareness of that digital divide and are thinking of the solutions to address that. Somebody put in the chats that the chat box that schools are also facing many of these same challenges. Absolutely. And in fact, I sit on the Equity Council of our Department of Public Instruction. And right at the beginning of the pandemic, they had assessed that about 15% of all school-age kids, or about 130,000 kids in Wisconsin, did not have access to technology, whether that be broadband and or device. And schools worked with broadband services providers. They worked with technology organizations or used their funding creatively. And now in the pandemic, because schools were pushed to do virtual instruction for kids to try to get something out of the remainder of the school year, they reduced that gap to just 5% of kids. So there, in Wisconsin, the Department of Public Instruction estimates that there's still about 40,000 kids that don't have any access to virtual instruction for a variety of reasons, but still is a pretty significant change. And I think that that benefits everybody in those communities when we are paying more attention to who's left out in the digital divide. A lot of people think there's been great advantages to better expansion and understanding of telemedicine. So in Wisconsin, and it might be true of you, definitely lack of access to mental health providers, and telemedicine, as it's become available, has helped to get people the expertise and care that they need. I still think we have a lot to learn, but because it's now allowed and billable, I think it is making a big difference. I do think that a lot of the local collaboration that we've seen around resources related to the pandemic and people just being aware of each other in communities is going to make a big difference too. So in Wisconsin, we have a pretty strong aging and disability resource network. We have ADRCs in most counties in Wisconsin. So we have 72 counties, and some are served by a regional ADRC, but most counties have their own. And those ADRCs have been working with the 211 people, have been working with the providers and hospitals, the county emergency management people. And now that they're aware of each other and have established some kind of local communication protocols that are, because of the pandemic, I think that there's going to be places to build upon that collaboration as well. And then, something that's very close to my heart, I think that Jasmina in my introduction mentioned that I'm co-chair of the Governor's Task Force on Caregiving, and that means that I'm working with a group of really talented people to advance some recommendations about how to address our direct care workforce crisis. And I think that our DSPs really, I'm hoping, will be part of the narrative of heroes during the pandemic. That these are people that continue to come to work and support people to make sure they could get out of bed in the morning and get dressed and continue to have a quality of life, even though in many ways they were putting themselves at risk and their families too. And so I'm hoping that we can, leverage on some of the positives of that. So I see a lot of things in the chat here. I haven't been able to track it as I've been talking to all of you. So I don't know if, Jasmina, if you want to help me to summarize what's been in the chat and if there are any questions.
Sure. Thanks, Lisa. One is, can you clarify what ADRC is? Absolutely.
So ADRC is Aging and Disability Resource Center. So they are funded through the through HHS, so through Federal Health and Human Services, and they're meant to be one-stop shops for people to, and in Wisconsin, they help to determine eligibility for aging and disability programs in Wisconsin, but they also house our caregiver support programs that are funded through the Older Americans Act. They have benefits specialists that help people with disabilities and older adults to manage their benefits. So they really are meant to be a one-stop shop of aging and disability resource support and information.
Thanks. Thank you so much, Lisa. If you have any questions, please put them in the chat box. I have been collecting a few, so I'm going to start asking them. One of the questions is, what kind of future planning do you think would be good if the individual is their own guardian?
So I would recommend going to the Google, the ARC United States Center for Future Planning, and they have done a good job of, they have what's called a Build Your Plan tool, and you can look from different audience perspectives. So there's different tabs there that show I'm a family member, I'm a provider, or I'm a self-advocate. And they've created some very specific videos for self-advocates, as well as a few guides that help self-advocates to think about that. I highly recommend that for a self-advocate where it's appropriate, that they think about this idea of a supporter. Now, I don't know if in your state, if you have a supported decision-making as a legal framework. In Wisconsin, we're fortunate that we passed a supported decision-making law. But even if your state doesn't have a law, supported decision-making is still possible. So for people to designate someone who can help them think about where might I want to live if my health or circumstances change? How can I get the support I need to open an ABLE account and think about my future finances in a way that can help me to get the things I want in my future? So I would look at those tools, and I'd also think about if there's a way to build someone's network with some supporters.
Thank you. The next question is, are your service recipients starting to go out in the community to get haircuts and salon services? If so, did you have any difficulties getting the individuals to wear their masks?
Well, once again, I'm not a provider, so I don't have that perspective, but I mean, I'm sure that that is true, because I've heard providers trying to problem solve these issues. I think that what we've been advising and the sorts of resources and tools I've been sharing with both the state in their reopening guidance, but also directly with providers, is there are a lot of really great videos out there or social stories to use with people to help them understand why a mask is important and why maybe to even get some practice doing that. So not everybody's going to be able to wear a mask. And I think that people will have to plan through different routines like getting a haircut to see how that can still be a safe experience. But I wouldn't count people out. So I would, get creative in terms of using social stories and videos and to give people the time to practice to get some comfort level with that.
Thank you. And Nikki, you asked, does that also work for therapeutic day schools for planning? I think we're going back to the previous question. What kind of future planning do you think would be good?
So therapeutic day schools, I mean, are those, I guess I'm not familiar with that term. I'm not sure what that looks like in Wisconsin. Are they serving children or adults?
I'm going to wait for Nikki to reply.
Okay.
While I'm waiting, I do have a question. So what are the plans for Survival Coalition in continuing to support people with disabilities during COVID pandemic? So what's next? I know you've talked about better data, et cetera, but what are you going to do for the next 6 months?
Yeah, good question. So Survival, we used to meet as a coalition 2 times a month, and at one point as our numbers were spiking, we were meeting twice a week, which is kind of exhausting. But we are now back to meeting once a week, and we just had a meeting today, and we really were diving into a couple of areas, but we're really concerned about those equity questions, and we admit that we're not necessarily very good at it. We are not a very diverse coalition, and we talked about how we need to get better at that, and we also have to be pushing our state to get better at that as well, in part because of the significant disparities in who's impacted by COVID-19, and also what we knew pre-pandemic about underserved populations in our state. So I think we are going to be, demanding better data and programming and supports that really help all populations in the state, including rural areas. So I think that's what you will see. And then also I mentioned really paying attention to what's happening to the home and community-based services provider network to make sure that we don't lose providers and that they get the support that they need, and that we continue to be able to have access to testing for people who use home and community-based services, but also the workers. So I would call those the top three: the equity issues, the home and community-based services provider network, and then direct support professionals.
Thank you. We have another question. You had stated that Wisconsin did not consider HCBS consumers in their emergency response plan, which I think is very insightful and important to know. How were you able to access information that supports that statement, or how were you able to come to that conclusion?
Well, I think it first came to light for us in terms of how PPE was being triaged to communities. So home and community-based services providers in the early days of the pandemic, when things were really difficult here, were kind of fighting for scraps when it came to things like masks, and then, you know, kind of their day-to-day needs, things that they typically needed just to take care of people, like gloves, were becoming more scarce. And so it was really listening to the providers about what they were experiencing and what was difficult for them that really helped us to identify that there was no source of support or policy or funding that was really addressing their needs. And so we started first by pushing on the issue of the PPE, but then it's since then become much bigger than that.
Thank you. Are you seeing any questions come through directly to you, Lisa?
I don't think so. Somebody is wondering about the ADRCs, and I think that our ADRCs in every state, I think that they could be, but I'm not sure if they are. In other words, there's federal funding available to states to establish ADRC networks. I do think that Wisconsin has one of the most robust ADRC networks in the country.
I have also posted, there is a way to find, if you're by zip code, there's a link that I just posted, find your ADRC through eldercare.acl.gov. So you'll be able to see. I had another question. You talked about virtual service delivery. Can you speak a little bit more about your experiences, or kind of what the service providers, or what you've been learning and hearing from them in regards to that virtual service delivery? Because I think at least community-based organizations that I've been talking to, there's still a little bit of a struggle. Things are kind of calming down and people are getting the hang of it, but I'm just curious what you've learned in Wisconsin.
Yeah, I definitely think this is an area of need. I mean, pre-pandemic, there was really no virtual service delivery going on. And this is probably true across the country. And like for most of us, I can't even count the number of, I probably had used Zoom like a handful of times, and now I'm on like 3 Zoom calls a day. So this is probably true for all of you. But I feel like providers were given permission to explore virtual service delivery, and we saw a trickling out of so a lot of like day services providers that tried to take their facility-based day programming and turn that into virtual service delivery, and they just kind of put it on a sheet of paper. Well, and then log into Zoom at this time, and we're going to talk about these things. And, you know, they're able to bill for that. I think we need to get better at that. I think that we've given providers somewhat of a path to say, go ahead and do it. It's a way to keep people engaged. Tell us what you've learned, and hopefully someday people will be able to get back to in-person sorts of activity and support. But I think that we need to work together to establish what are those best practices in virtual service delivery. How can people with a range of intellectual and developmental disabilities benefit from virtual services? I'll say once again, from my experience as a parent of a young adult woman with IDD, that She was in her school transition program at the end of the school year, and they sent all sorts of materials and tried virtual engagement with her, and it just didn't work. And I don't think she's all that unique. But I do think that we can get better at it. We can document what we've learned, what's worked, what didn't work, and what sort of support someone might require, like a light touch support that's going to make that more successful.
Thank you so much. And Lisa, I'll be talking to you about our virtual initiatives here. Please let us know if you have any other questions. I just wanted to remind everyone about July 7th, next week's webinar at the same time, preparing your employees for the impact of COVID-19, updates from providers. We're having Ed Call and Eligio Velasquez presenting. We've worked with them for almost 15 years, and ARCA is in New Mexico, and it's been, they've done some pretty amazing things. So I'm just kind of putting a plug there for the next week's webinar, and I put the registration link in the chat box. Lisa, well, we still have a few more minutes. Any other or kind of any concluding last sort of messages or what could we just take home messages for this webinar?
I'm a little concerned about state budgets. And I think that all advocates, providers, all the people on this call should be thinking ahead to that too. It's so easy to get stuck in the day-to-day of what's happening and what policies we need to put in place or what fires need to be put out. But I think that states are really going to be in some dire straits with their state economies, state revenues, and their state budgets. And we know that too often that Medicaid and home and community-based services can be put at risk when states don't have a lot of money to spend. And so the progress that you've made in like reducing, eliminating waiting lists or downsizing institutions or improving competitive integrated employment might all be put on hold, paused, or maybe stopped altogether. And I think that you need to be prepared for those scenarios, think creatively about how, reimagining services can maybe even create some efficiencies, and how can the funding be reinvested so you don't lose progress for people with IDD and services and supports. So I would, if you don't have a coalition like Survival Coalition, I would urge you to think about who you can collaborate with. In Wisconsin, the combined efforts of advocacy organizations like those that belong to the Survival Coalition working alongside providers, who oftentimes that doesn't happen. So providers have their, can be perceived as having their own kind of goals and perspective, and they don't always align with advocates. But we found that our voice in the pandemic really is much stronger in advocating for things that are necessary. And I think that a really strong voice and movement is going to be super important in across the country in our state budget processes.
Thank you so much. We had a couple of, there's one comment, the ARC of Gloucester is developing a social media platform for people with intellectual and developmental disabilities to help them socialize and reconnect with friends, family members, and coworkers that they haven't seen since COVID. This is a safely monitored platform, and Robin is asking, is anyone interested in joining? Robin, if you send me information, I can kind of look at it, and I can definitely send it out through our listserv as well. So, I will send you my email so you can send it to me. And then there was another question. I'm just wondering if you're going to be, oh no, hang on. Sorry, there's lots of questions. I work for an IDD day facility, and in this area, we're currently facing the most surge in cases. Is it considered to be too risky to be open during times when positive cases are at its highest?
Oh, that's a really good question, and I'm not sure that there is a good answer, because there's risks no matter what you do. And I know that depending on the people's care scenario at home or whatever, wherever it is that they live or spend their day when they're not with you, is always worth considering. I guess I don't really have good advice, although I think that, back to that person-centered planning, individualized planning is really important during these times. Because if somebody's living with an aging caregiver and mom and dad have been doing all the cares and there's like a great risk, if something doesn't happen, I think that we need to figure out how to get that person with IDD back and engaged in something so that caregivers can get a break, and how can we do that safely. So maybe it's not bringing everybody back all at one time, but it's thinking about who can come back and come back safely. What are some ways to triage individual supports to people who need them? And what I'm seeing here is people are getting really creative, where elderly mom and dad don't necessarily want their adult son to go back to the facility for day services, but somebody's meeting him at the picnic table outside, doing some activities a couple times a week, wearing PPE. And that's enough to give mom and dad a break. So I would think, look at all your clients individually and try to figure out what's the best and safest plan for everybody.
Thank you again, Lisa. We're at 2 o'clock, so I don't want to keep anyone. There are some questions about a recorded webinar. We are recording it. Once we post it and archive it, and it's taking us about a week I usually send out an email right about in the morning of the next webinar. So next Tuesday, you will be getting a thank you email for attending, and all the archived webinars, webinar PowerPoints, and any of the PDFs that I've been email or texting, we will make sure that they're there. Please, if you have any questions for Lisa further, please email her. And thank you again for attending today, and have a great day. And Lisa, thank you so much.
You're welcome.
We're getting lots of thank yous. So
have a good afternoon, everybody.
Thank you. Bye.
Bye.